morning. Welcome to Dr. Oscar Dalmao Dental Implant Center. My name is Sabrina Dang. I will show you my typical day as a hygienist. So let's get started. So now let's follow me into my room. Welcome to my room. So this is my room. It's typically set up just for hygiene. Let's start to show you what I usually repair for my patient before I bring the patient in. Over here, where the cuspidor for the patient to run, I put a disposable Dixie cup, saliva ejector already set up with a sleeve, the overhead light barriers already set up on the light switches and the handles. This is the basic setup that I usually prepare for every single patient that come in for scaling, polishing, and fluoride. On this tray, we have a cassette with instruments that already been cleaned, packaged, and sterilized with the date, the low number, and the initial of the person who sterilized the package. Also, there is a disposable hairnet, disposable daisy chain, disposable bib. Next item we have here will be the fluoride, a contra angle, disposable airway syringe, a prophy cup, prophy paste, and a sleeve for the airway syringe. Disposable daisy chains is there, gauzes, and safety glasses for the patient to wear during the procedure. Good morning, Berta. How are you doing today?
I'm good. How are you, Sabrina?
I'm doing great. Haven't seen you for a while. What news and exciting?
Just almost done with school.
Oh, that's good.
Yes.
So before we get started, do you mind to put on the safety glasses for me, please? All right, I'm going to put a bib on for you. If you don't mind, I'm just going to loop this around your neck. Okay, so Berta, before we start the procedure, because of COVID, so we changed a little bit of protocol. So I need you to rinse with the hydrogen peroxide that I prepare over there for you for about 1 minute. Keep it in your mouth and spit it out. So please do that. There's another thing I would like to do before I start the procedure, which is I need to take your vital sign, okay? So if you don't mind, could I have your arm, please? So your legs already uncrossed, perfect. And you can put your arm down, palms up right here. Thank you. Okay, so the reading is really good. Your blood pressure is 112/69 and your paw is 62. The standard is 120/80. However, with this reading, do you exercise daily, correct?
Yes.
Okay, so people who work out, normally their blood pressure are a little bit on the low side. So for me, this rating is great. Okay, so now we can get started.
Okay.
So now that we already finished taking your vital sign, I'm going to bring the chair down. Then I'm going to start checking extraorally, okay? Okay, Berta, I'm going to check extraorally all your lymph nodes to make sure everything is fine. Just turn your head toward me for a second. So if you don't mind, Berta, can you swallow your saliva for me, please? Again, one more time. And last time, please. I'm going to check your TMJ. If you don't mind, try to open slowly all the way wide. All the way. And now slowly close your mouth. what I'm doing is to see when you open your mouth, is there any clicking and popping on the TMJ, okay? If you don't mind, can you do it one more time, please? And you can close your mouth slowly. Thank you so much. So, Berta, I'm going to remove my gloves because I was touching your face. Now I'm going to change it, and I'm going to change to another pair of gloves before we go intraorally, okay?
Okay.
Okay, Berta, I'm already disinfected my hand. I'm going to put on a new pair of gloves before I check you intraorally, okay? Berta, I'm going to check intraorally, okay? If you don't mind, open for me, please. Okay, Berta, if you don't mind, could you stick out your tongue for me, please? I'm just gonna grab it here. So everything seems to be within normal limit. I don't see anything that is abnormal. I'm going to start doing your cleaning now, okay? All right, let's get started. Okay, Berta, we are done with the cleaning now. I'm going to bring the chairs up so that way we can review the brushing and flossing technique, okay? So Berta, I'm going to show you the proper way to brush your teeth with the brackets in the middle. So we need to change the technique so that way you can be able to brush your teeth properly. Then you won't build up plaque and could even furthermore lead into some decay.
Okay.
So Berta, now you have to angle your toothbrush differently. The bracket is right in the middle. So you're gonna put your toothbrush, the bristle at 45-degree angle from the top. You're gonna go back and forth to massage the gum right at the gingival margin. Like that. You start from this side. And you go move forward. Keep going here. Then also the bracket's right there. So you're gonna move your toothbrush also right below the bracket at 45-degree. Gonna brush from down here up, just like this. Now we're going to change the angulations. The biting surface, you still brush back and forth just like normal, how you would be taught to do. The inside surface, you're gonna go back and forth at the gingival margin a couple times, and then you flick down. Again, back and forth, flick it down, back and forth, flick it down. For the front teeth on the inside, you're going to brush differently. Now imagine your toothbrush. This will be the toe, this will be the heel. The concept will be heel to toe, from heel to toe. So you're gonna leave the toothbrush sideways like this, starting from heel to toe, heel to toe, heel to toe, heel to toe, heel to toe. You will do the same technique with the lower front teeth as well. Heel to toe, heel to toe, heel to toe, heel to toe. For the bottom arch, you will do the same thing from underneath the bracket, back and forth brushing, above the bracket, back and forth, back and forth. The biting surface, again, back and forth. The inside, you're gonna go right at the gingival margin, back and forth. Now flick up. And that is how you brush your teeth. So now that I already show you how to brush and floss your teeth, do you have any other question that you want to ask?
No, Sabrina, thank you for going over with me how to brush my teeth better since I have braces. I will take that information home and start doing that. Okay,
so before you leave, I would like to book an appointment for you to come back to see me in 3 months for hygiene.
Okay.
And that visit, we're just gonna do hygiene since we already polish and fluoride this time. And I'm also gonna send you home with some toothbrush, floss, and toothpaste, okay?
Okay.
Awesome. You're welcome. All right, that's it. Thank you so much for watching the video. If you find it helpful, please give it a like and share the video. And also don't forget to subscribe to our channels, and we'll see you in the next video.